Good afternoon, Yellow Medicine East Community Superintendent Mr. Schneider, accompanied by high school, middle school administrative assistant Crystal Enninga. We're going to review the numbers and give you an update on what our learning model will be for next week and actually a little bit further out. As you can see here, Candy Ojai is still the highest in the area. One point to note is that Yellow Medicine did increase with that number, which is 2 weeks old, but all the other areas, area counties are also very high over that 200 mark. So we're doing well in terms of increase, but all of us regionally are not doing very well. That puts us all in distance, the recommended model. And you can see that basically in the state of Minnesota, all of us are in that. In fact, I couldn't find the one county on the document that I had printed from the Department of Health that is in that 30 to 50. But I did find that what I believe to be the lowest county is Cook County, which is, I believe, in the Arrowhead area of Minnesota. Here's our daily case counts that were true yesterday when we got those at 11 o'clock yesterday. 12 for Yellow Medicine County, Chippewa was 19, and Renville was 19. Today was even better for us. We went down more, but over the past week, Yellow Medicine County grew by 158, Chippewa by 103, and Renville by 185. So still growing pretty good. Yellow Medicine County had one more death in the past week. Chippewa saw 8 deaths, and Renville County saw 7 deaths. That's just in the past week. Active case data, this is really pretty valuable, and please note down there that the Countryside Public Health Dashboard has added a graph that shows the active cases in our area, and it's kind of showing the trend. I thought that was pretty valuable when I looked at it. This week though, as of yesterday, Yellow Medicine County showed, and it's actually 2 days old because they update this about 7 or 8 o'clock at night. Yellow Medicine County was at 104. That decreased by 37 compared to the previous week. Chippewa County decreased by 51. Lacaparo went down by 2, and Renville went up by 7. Renville still is continuing to grow. They did flatten out a little bit yesterday and today, but it's still going up, generally speaking, in Renville County. Staff and student data. One thing to note here is this is the best we can to assemble this data. It's not perfect, and sometimes the numbers won't match up perfectly. We do the best we can to scrub it out, and some of it is impacted by the time that I pull this out. I probably pulled this information about 11 o'clock yesterday and started filling this out. I fill it out throughout the day, these slides, and I don't update them from yesterday to today. But in the past week, we've gained 14 more absences, COVID-related absences in our staff. Total staff positives grew by 4 in the past week. In our student-related absences over the past week, it did grow at BRE by 22, and our middle school, high school grew by 3. It's important to note middle school, high school has not been in session as much as BRE has. Student positive district-wide grew by 8 in the past week. That doesn't mean they became positive in that week. That means when it was reported to us, that number increased from last week to this week by 8. And that 39 positive students represents about 5.7% of our entire student body. And you should be able to go on to area schools here, look at their dashboard and see how we're doing in comparison to them. Student information. So when I drew this yesterday about 11 o'clock, middle school, high school had 9 students that were active. That means they're absent and have been positive. So that's roughly 3%, 2.8% of our high school, middle school enrollment. When I say that, we actually have 378 enrolled, but 60 of those are in elective distance learning. BRE had 2 as of yesterday, probably grew a little bit today. If I recall, my reports correctly, but that's still less than 1% of BRE's student enrollment. Over the past week, from last week to this week, Granite Falls grew by 46. Granite Falls proper in the zip code. Canby grew by 19. Clarkfield by 5. Henley Falls by 1. Echo by 5. Porter by 2. And Wood Lake by 7. So for Echo and Wood Lake and Granite Falls, that's both kind of alarming numbers there that we still have it in our community. Montevideo continues to grow also. Hopefully that slows down. All of these slow down and we can put a dent in this with further mitigations that we can. This is a 14-day case rate and what we anticipate. Remember, this would be 2 weeks old at each of these benchmarks. So right now it looks like we would expect that Yellow Medicine County would be at 120.85, still a high number, but not as high as it was. So it looks like we are definitely trending down. Looks like Chippewa hasn't reached their peak yet, but will in the next couple weeks. And so if things serve me well, these numbers should be pretty accurate, but we'll see. It's still too far out to have a sense of that. Local hospital is continuing to be near or at capacity. When I talked to a local healthcare provider, they indicated that that hasn't decreased. The one anecdotal comment was made is that we are seeing it pretty heavily in our nursing homes right now. So we haven't been able to keep it out of there. That usually is an indicator that we have it out in our community and somehow it's seeping in there. Vaccine update, not expected to reach us for a while. The healthcare providers and congregate living or nursing homes will get it first. So basically what they're saying is don't count on the vaccine to really solve this problem. We need to stick with our current plans. Quarantine timeline, I will make a recommendation about this on Monday night. I have to work through it, make sure I fully understand how that will be implemented. The problem is that Countryside Public Health and our regional support team have not come out with recommendations on how this should be implemented at this point. I suspect they will do that in the next week or two. It's not going to have a big impact on us right now, but we hope that can shorten some things when we can very closely monitor students. It will be hard for us to monitor students, but it should be a lot easier for us to monitor staff. And many of our decisions have been based upon what our staffing has been. So maybe we can shorten some of those quarantines in certain situations. The Minnesota Department of Health and the regional support team have talked about a phased-in approach. And what that is not all students would come back at one time. So we didn't overburden our system or the staff that have to monitor that and do the close contact notifications. So we will monitor that the best of our ability, and hopefully a phased-in approach will not overwhelm us. So allowing participation in activities is definitely something that gives some students opportunities to engage. We are looking forward to that. We want that to come out, but we do not know at this point what the plan will be. And I haven't heard, I think if you watch Twitter, you probably get better information than I do sometimes. So from the feedback I've received, it's obvious parents, students want to be back in the building, but they want to do it safely. We can't just force people into distance learning if they are not feeling safe, because that is a burden on our system too. We don't have another teacher sitting there just to do the distance learning at the same time. We know from the reports of everyone that mental health has become a bigger issue and we need to monitor that better. We'll continue to try and put out resources there and look at different ways to kind of support those students, including our social workers and redirecting to other resources that are available. And I put that in my announcement last night too. So With that, what was decided last night or recommended last night by the incident response team or by the incident command team was that we would have an accelerated phase-in approach. So their actual phase-in recommendation is that you do it over a week or two's period, but we're going to accelerate that coming out of the holidays. So January 4th and 5th, we would have all pre-K through second graders here and our middle school. They're separate buildings. We feel safe that we can monitor that. So at that time, then our grades 3 through 5 and 9 through 12 would both be in distance learning. January 6th and 7th, then we would get everybody back into our building in some form. All BRE, so those 3rd through 5th graders along with the pre-K through second graders would come back. Our middle school would still be here, and our high school will return in their hybrid and AB form. We don't have the space here. As you know, the storm took our auditorium, and that was going to be a big part of our solution and how we could space kiddos out in our building. We do not have that space at this time. And then January 11th through 14th, we will continue with what we did on the 6th and 7th. Please note that January 8th and 15th will be distance learning for all students. That's something to look forward to. We hope everybody will make good choices over the holidays and be ready to come back in a safe manner because what you do out there does impact us. The other part of the recommendation that was made last night was that middle school, high school activities would begin based upon what the high school league puts out. So basically, if the governor allows the executive order to expire on the 18th, we would start those activities. Right now, the plan would be to start them on the 21st, but that's dependent upon what the governor decides. Ultimately, the ball's in his court. And with that, then the incident command team will not meet again till January 7th. I will provide them with weekly updates. The dashboard will be maintained to the best of our ability. We continue to beg for people to tell us if you have COVID in your family, let us know so we have an idea, so we don't get back here for one day and find out we have a bunch of positives or a family or a household that's having a problem, and we make decisions based upon inaccurate data. We need accurate data. I know it's private information, but we need that so we're making safe and the best decisions that we can. Crystal, do you have any questions for me this week?
I don't have any questions that are burning, but I have to tell you, after last night's decision with the incident command team and actually having a date set where we can have kids back in our building, our staff is just giddy with excitement. I know it's probably the best gift to all of them. So I know we're all excited to see your faces, and we're looking forward to it. So.
Yeah, I know in talking to the principals today, they were very excited about what's going to happen that week. They're still trying to do some great things to end this, end 2020 and stuff. So they are very much looking forward to it. The teachers are too. I can tell a little extra spring in everyone's step that they'll have this opportunity. Thank you, folks. Stay healthy. Continue to follow those guidelines. We need you to wear your mask, social distance, wash those hands, cough into the crick of your arm, and do everything you can so we're safe and healthy when we come back in the new year. Have a great holiday season. Thank you, folks.